Hi, good morning, everyone. Welcome to our weekly session happening every alternate Saturdays. Today is 19th of April, and we have a very important topic. We are all close to this topic. Everybody has stress in life. Uh, what, how, when? We have an expert to understand how we can manage the stress. What is stress? I think everybody in life is getting involved in stress at some point of time. So, to talk about this topic, we have Dr. H Asrani. He's a family medicine doctor, Diplomate National Board Family Medicine with MBBS. Dr. H Asrani brings on table a rare found combination of active clinical practices over 47 years, training of doctors and insurance professionals for over 30 years, and insurance domain experience of over 25 years. He has completed executive education in blockchain and artificial intelligence. With deep insight into consumer behavior and having extensive medical intelligence, he pioneers in disseminating knowledge via his numerous health and medicine related trainings across topics including acute disease management, chronic disease management, wellness, preventive health information, insurance fraud management, and various other, all while leveraging medical insight. Worked as a senior consultant at World Bank for capacity building and medical audit for Ayushman Bharat, world's largest and ambitious mass health scheme. He has been a speaker at medical and clinical audits at Claims Forum Asia at Kuala Lumpur in August 2016, training in collaboration with Malaysian Insurance Institute in the year of 2021-22, training in collaboration with Singapore College of Insurance, conducting 3 training programs in 2024. We are proud to have you here, sir, and please, over to you.
Thank you very much, Saurabh. It's a privilege to be here at such an august gathering. The topic I have been given today is actually a 6-hour workshop, which I am going to give a glimpse into it. All of us are practitioners and we know how to manage stress. So, we have to understand stress at least a little, what we must know about. If we don't understand, it's going to destroy us. It's going to decimate us. In 1970, American sociologist Alvin Toffler predicted that rate of change in modern civilization would accelerate to such a degree that enormous number of people would experience shattering stress and disorientation. Toffler described this condition as future shock. I don't know how many of you have read this book, but this is largely because our human evolution, our brain evolution cannot keep with the technology advancement. And then we are always feeling that, oh, we have to still speed up. A new word has been coined, hardiness, for people to tolerate stress. It's virtually impossible to avoid stress. And anyone who can say actually is, I have no stress, is either bored in life or a very curious person. Because some stress is required for us to perform better. People need to get tough. A new word has been coined in the social sciences to describe stress toughness known as hardiness. I will compare hardiness with hepatitis B virus. HIV virus can survive in open air outside the human body not more than 10-15 seconds But a hepatitis B virus can survive 6 months outside the human bodies, even 6 months. So that is hardiness, and we have to get tough because our situation is going to keep challenging, especially as we grow in our stature. What is stress? Well, one can talk 2 to 3 hours on stress. What is stress? But to narrow it down, any demand, physical or mental, that is placed on our body can give stress. I am a smoker. I have been told to give up smoking. But I say, oh, I can give up anytime I want. What's the hurry? One day I get an ulcer on my tongue. I go to a doctor and a biopsy is done to rule out cancer. I'm fortunate I don't have cancer. Now I'm forced to stop smoking. That is a demand on me physically and mentally. And that is going to give me stress. All stress is not negative. As I said, stress is good. It helps us perform better. The stress of an exam going student, the stress of a person appearing for an interview, the stress of a surgeon performing a complex surgery. Look at this tent. Tent is made up of a simple piece of cloth, and you have a post and you have a cloth and you have a wire. Only when the wire is put under sufficient stress or a pull, you have that piece of cloth turning into a tent. And that, friends, is our eustress. It makes us perform better. Stress is personal. What may stress you may not stress me. It's different to different people. To the student, it can be exam pressure. If there are two brothers appearing for a board exam, then it is a competitiveness. To the motorist, hassle of heavy traffic. To someone in a rickshaw or a bus, obnoxious exhaust fumes. To a doctor running a one-man industry, private practice, managing low business period with liabilities not reducing, and at the same time striving to achieve best quality of service and maintaining ethics is stressful because we do not have all working days OPD, heavy OPD. Stress is diagnosed not by causes, because what can cause me stress will not cause you stress. It is diagnosed by symptoms. I'll give you 3 scenarios. I am walking at 11:30 in the night in a by lane, and unfortunately the light in the lane has gone off. I hear footsteps behind me. I turn, I don't see anyone. I start walking, I again hear footsteps. I get a funny feeling in my chest. I may get palpitation. I get an empty feeling in my stomach. I have perspiration on my forehead. That, friends, is stress, physiological response of stress. Instance 2. Sorry, instance 3. Instance 2, I am coming to. Sorry, 2 is missing. So, instance 3. A girl gets in an elevator on the 23rd floor. She's alone, and as the door closes, a boy walks in, working in her office, but they don't know each other. 23 floors down, the girl is tense. Will the boy try something or will he not? And if he tries something, she is bracing herself to fight back. This happens every day of a week. The boy does nothing. But even on 7th day, the girl goes through the same feeling, a funny feeling in the chest, palpitation, emptiness in the stomach, some perspiration. 1 week later, she goes to an orthopedic surgeon with a neck pain because she was bracing herself to fight back. And the next instance is I have just proposed to a girl. I have been told to come tomorrow to a coffee shop to get the answer. I'm waiting. And when she walks in, I cannot fathom from her expression, is it going to be yes or no? I get the same feeling, emptiness in my stomach, perspiration on my chest, and palpitation. Or in a company when people are being given pink slips and suddenly boss calls you and you heard loud noises from the cabin in the morning, waiting outside, you get the same symptoms. This is all stress. Hans Selye's you, who was Hans Selye? Was a Hungarian Canadian endocrinologist who conducted important scientific work on hypothetical non-specific response of an organism to stress. Stressor. Stress is the non-specific response of our body to any demand placed upon it to adapt. Me forced to adapt to no smoker. This is a physiological demand. Whether the demand produces pleasure or pain. A boy meets his college girlfriend after 30 years. They hug and kiss. The same amount of physiological response will come in. Physiological or not, whether it is mental or it is emotional, the same response will occur. We'll be seeing ahead what endocrinology problems occur to cause symptoms. Holistic medicine view, stress is inability to cope with a perceived or a real threat to one's own being. Something which I have to do. If I don't give up smoking now, I may be diagnosed with cancer at the next biopsy. It could be mental, it could be physical, it could be emotional. Footsteps behind me, a girl about to say yes or no to my proposal, which results in a series of physiological responses and adaptations. Our body has to adapt to that. So, stress physiology boils down to a simple thing, fight or flight response. Two emotions are very common in stress, or rather, I would say the whole thing boils down to two emotions, anger and fear. So, if I have anger, I wish to fight. If I have fear, I wish to run or flight. So, it is known as fight or flight response. A girl gets married, intercaste marriage in India, and mother-in-law does not treat her well, gives her abuses to her family. The girl wants to hit back, but she has cultured family. She does not do anything. She just stands rooted at one place. This girl may faint because she is body is producing stress chemical which she is not using. I will give a corollary here. All of us drive. So if you have a non-automatic car, you accelerate the car, but you do not engage into a gear. You hear whining of the engine, you are damaging the engine. Similarly, this girl, she wanted to hit back to her mother-in-law or run away from there, but being a cultured girl, she does nothing. Her body is producing stress chemicals to either fight or to run, but she's not consuming them. It's like whining of an engine, it damages her. Arousal, I will show you what arousal occurs, also happens for non-physical stressors, mental, emotional, and maybe spiritual. No matter if the threat is real, a car accident, or a noise at night, footsteps behind me, the stress response is same in proportion to the perceived danger. Some people are scared of cockroach or rats. Their stress response is huge, whereas other people, they do not perceive that as a big risk or a big danger. Their response may not be so huge. So how does it occur? There are stages. Stimuli received by the brain through one or more five senses. We have five senses. One of the senses receives the stimulus and tells the person, oh, now you are under threat. Brain deciphers the stimuli either as a threat or non-threat, and the body reacts. Body reacts till the threat is over. Body returns to normal or homeostasis once the threat is gone. I'll give an example. Pictorial presentation. This is our human body. We have a heart that sedately beats at 60 to 80 beats a minute. But when we are running or when we are under stress, this can go up to 120, 140 also. We have a blood pressure that is usually 120, 80. But when we are running, physical stress or we want to fight, it can go up to 200 also. We have a blood glucose level and we know whether we are fighting or we are running. The muscles need glucose, the body produces glucose, our sugar levels rise. And whether we are running or we are fighting, our muscles are bracing themselves. Our muscles need strength. Our lungs normally breathe at 12 to 16 times a minute. But now in anger, our breathing becomes shallow. You know, it is common saying, I was so scared that my breathing stopped. We have a stomach that is working like a concrete mixer every minute. But now when energy is required at multiple places, our stomach slows down. This is what gives a feeling of emptiness in the stomach and a feeling of fear with pupil dilatation. Now understand, friends, when all of these physiological changes are occurring in your body, will you not have noticeable symptoms? And when this stress is regular, this person will have resting tachycardia, resting hypertension, hyperglycemia, neck pain, breathing difficulties, or hyperacidity. What are the symptoms of fight and flight? Because for whatever you do, you need this. Increase heart rate, increase blood pressure, increase ventilation, vasodilation of arteries to body's periphery, arms and legs, because blood is needed for the muscles to function. Sir, I think somebody is talking in the background. Can you please mute yourself?
Uh, sorry, I just muted. Please, I request everyone to mute yourself while the presentation is on. Thank you.
Blood sugar levels go up because our muscles need sugar for energy. Muscle strength increases because whether you run or you fight, your muscles need strength. Stomach movement reduce, as I explained to you, because the energy is diverted elsewhere. Increase perspiration to cool body core temperature, because perspiration occurs, core temperature is to be cooled, peripheral blood supply is required. And for muscle to use energy, I'm sure when you did your lipid profile or lipid metabolism, our free fatty acids give us maximum amount of energy. So we mobilize that also. And dilatation of pupils. Why it occurs? Activation of sympathetic nervous system, which prepares body for fight or flight response. This will be little more clear. That is my brain, cerebral cortex. This is a stressor. One of my senses sense that there is a threat, a stressor has been noticed. Cerebral cortex, through reticular activating system, works on the hypothalamus. The stressor directly also stimulates hypothalamus. This hypothalamus releases corticotrophin releasing factor and thyrotropin releasing factor and work on pituitary. Pituitary, before pituitary starts action, hypothalamus also through sympathetic nervous system activation produces adrenaline via action on adrenals. Pituitary also acts on adrenals through ACTH. Pituitary also through TSH acts on thyroid and produces thyroxine. Adrenals produce adrenaline, noradrenaline, aldosterone, and cortisol. All these four hormones and thyroxine lead to physiological arousal, tachycardia, hypertension, hyperglycemia. Now, Hans Selye did not evaluate the role of glucocorticoids into all of this, but he has done the basis research in endocrinology. I am sure it is now very apparent to everyone how stress response occurs within seconds. Hypothalamus activates adrenal gland to release adrenaline and cortisol into circulation. Adrenals gland secrete more adrenaline because of sympathetic activation directly. This adrenaline coming in circulation has multiple effects. Blood supply to muscles increase. Sweat glands produce more sweat, leading to cooling of body. Heart rate increases. Person feels palpitation. Pupils dilate and rate of breathing increases, leading to shortness of breath. All the symptoms of stress based on endocrinology. Immediate effect of stress, sympathetic nervous response, epinephrine, norepinephrine released, 2 to 3 seconds, like a phone call. This is the immediate response. Then intermediate effect, adrenal response, both being released again from adrenal medulla, 20 to 30 seconds, like an email. And prolonged effect, if the stress continues. If the stress continues for long, like the girl in the elevator, this ACTH, vasopressin, thyroxine, they affect the various metabolic processes. Time, minutes, hours, and days, something like a snail mail. So we have instant, intermediate, and prolonged effect of stress. That is why people have to be counseled that if you do not manage your stress well, you land up with early hypertension, early cardiac problems, early diabetes, even if you do not eat sweets at all. So, how does stress reactivity influence our body's functioning? It changes our cardiovascular system, changes our GI system, changes our musculoskeletal system, skin, cooling of the body, and immunity goes down. When all these systems are working over time, our immunity goes down. So people who are under stress also get an aggravation of asthma, allergic asthma, or allergic rhinitis. What are the changes in cardiovascular system? Increase heart rate, increase blood volume, increase blood pressure, constriction of certain blood vessels leading to ischemia. Stress is one of the common causes of coronary artery disease. Dilation of coronary arteries, people feeling faint, increase force of heart contraction, so getting left ventricular hypertrophy, increase blood glucose, free fatty acids, and cholesterol, leading to plaque formation. I eat very well. I don't eat wrong foods. I exercise regularly and effectively. Why should I have atherosclerosis? Because I can't handle my stress. Gastrointestinal changes, decrease saliva, so people feel dry mouth. You have a patient coming to you saying, I have dry mouth nowadays, and you examination is normal. Ask the question, what is the stressor nowadays? Contraction of esophagus, difficulty swallowing, esophageal dysmotility, increase hydrochloric acid in the stomach, leading to hyperchlorhydria, the stress of a senior vice president of an advertising industry who's always tackling deadlines. Change in peristalsis leading to dyspepsia, stomach not emptying in 2 to 3 hours. Other changes, skeletal muscle increased tension due to muscle bracing, so pain, you have backaches, you have neck pains. Smooth muscle increased contraction, bladder bowel increased frequency, increased perspiration, galvanic skin response, generally feeling cold. Doctor, I feel chilly all the time. Decreased temperature of the skin, again feeling cold. And immune system weakened. People can get autoimmune disorders also due to stress that is not contained. Allergies, asthma, hay fever, rheumatoid arthritis, backache, including temporomandible joint syndrome. Why TMJ syndrome? Because when you want to fight or flight, but you can't do anything, you tend to clench your jaws. Essential hypertension, stroke, because of atherosclerosis, coronary artery disease, ulcers, esophageal or stomach, migraine headaches, dilatation of arteries, and tension headaches because of muscle bracing. Cancer also has been, although I will put stress as the last cause for cancer, there are other carcinogens, but yes, keep one thing in mind. When does stress occur? Individual stress, an individual, me alone. When will I get stressed? I have a challenging situation, a job interview. Last month, a patient of mine came to me and says, I have been laid off because our bank made some bad investments and I have been told to go. Tremendous stress. Can't even tell mother. For 1 week, he didn't even tell his wife. And senior position jobs are not available. School exams. Not only students, parents also go through stress if it is a important exam. Difficult conversations. I have been called by my boss to explain why currently my performance has been poor. Major life changes like relocating, starting a new job can trigger or bereavement, losing a partner, losing a parent, losing a child, feeling of being overwhelmed. Oh, I cannot cope with this. I am practicing in my clinic. My clinic times are 4 to 6. I have to reach a place at 7, which is around 30 kilometers away from my place. And that is absolutely important because that is for my benefit. At 5:30, my assistant tells me, sir, there are 20 patients more. I am overwhelmed. I can't handle that many patients in 30 minutes and still meet at my place. Although it's a short time stress, it gives stress. When responsibilities feel too much to manage, or when deadlines loom, all the industry, advertising industry, marketing industry, nowadays IT. Friends, those of you who are in practice for long, I can say for India at least, when I started practice in 1977, we would get a CBC report after 48 hours. You didn't have to answer your patient why the fever is there. Today, the report comes in 20 minutes. That is a stress. Lack of control. Situations where individuals feel they have little or no control over the outcome can lead to stress. I am explaining to my boss that I need this job badly. I have EMIs to pay. But then boss says, I'm sorry. Group and community stress. Multiple feeling stress. Shared experiences, family members or community members share experiences that cause stress. Large scale events, natural disasters, acts of terrorism, pandemics. COVID gave tremendous stress across the world, or changes in the society can also cause widespread stress. So, stress is all around us, and we have to be ready to manage it. Stress is inescapable, it's continuous, only the levels change. There are comfort zones in between your family, your children, but then if the stressor is big, the negative thoughts comes back. Stress is not inherently negative. I have already spoken about eustress, the stress of performing. Individual differences exist in reaction to stresses. What may stress me may not stress you. Stress can be managed. We as individuals and we as doctors have to tell our patients stress can be managed. Just do it. Exercise regularly. Stress chemicals are burnt by exercise. So, the first principle of fighting stress is exercise. Improve the physical health as effective exercise burns stress chemicals, all the hormones. Improving psychological health, learn to relax, learn to meditate. Consume those stress products before they result in illness. And learn or master relaxation techniques. Relaxation technique doesn't mean that, oh, I'm just lying down, I'm relaxing. No. Activities, reading a book, watching television, watching cinema, listening to music, going to the sea and listening to the waves. Main ingredients of effective coping techniques: increase your awareness of the cause of stress. What is causing stress to me? Identify your stressor. Before that, accept that you are stressed. In my clinic, if I ask 100 people, so what's stressing you? No, nothing. And when you probe further, it's a martyr complex. Oh, doctor, you don't know what all I have gone through. I cannot get stressed anymore. No, accept that you are stressed. Process information about your stressor. how you can manage. Talk to near and dear ones, talk to your doctor. Adjust your attitude, maybe your behavior. Is your behavior leading to stress, or is it not your behavior? Work towards a peaceful resolution. Stress can be managed successfully. Thank you. That's all from my this thing, and I think I have just completed in time.
Thank you, sir, for explaining what is stress and how is it affecting our daily life. So the forum is on for the question answers. Okay, let me ask everyone to unmute. Okay, so people can unmute and they can ask questions. Dr. Bukhari, you want to ask something?
Yes, thank you so much. Thank you so much, Asani. Very beautiful and descriptive information. I am one of the person who listen your uh, lecture very carefully.
Thank you, sir. Thank you.
Thank you so much. Very important thing, you know that on one way you say that it is a protective. Everybody has a stress, and if anybody say that I do not have a stress, he may be a casual person. What I feel I experience, I think you and we must add exercise is very good to cope it, and like yoga or some. And very important thing in Pakistan, I see, is the religious involvement. If you see, if you are in stress, you can adopt many. You can go and your religious meeting, or you can. And the third thing that I have seen in Pakistan, that is your sleep. If you are in stress and if you go to sleep, I think that can reduce the stress. I saw in Pakistan when there was a COVID, many of the people died not due to the COVID, they died due to stress and their physical pain. And another important thing that you indicated that if the stress is like in our young people's, not I am about your age 70 year. If in the young people, they can tolerate, but if the stress in old people who are suffering with atherosclerosis or other thing, I have seen something in my family. They are diabetic. There was no genetic or family history, but they have become diabetic. I think this is due to stress or something else. Thank you so much once again.
Thank you, sir. Thank you.
Thank you so much, Dr. Bukhari.
Can I ask questions?
Please go ahead.
Yeah. I did join late, but definitely it was a wonderful session, actually, very informative.
Thank
Uh,
you, sir.
very often we come across, we are not aware of our own stress levels. So, are there any tools actually through which we may be able to assess our own status? Are we stressed heavily? I mean, till it becomes too, I mean, we realize it till it becomes too late. Can we have certain tools that we can assess stress? And one more thing, I have heard a lot of people nowadays saying about positive and negative stress. I didn't understand what is being a positive stress and what is negative. I mean, and people also says that little bit of stress is required if you want to progress or move ahead. So I need, uh, I mean, your views on these thoughts.
Yeah. Can I answer, Saurabh?
Yes, sure. So,
See, now you're seeing that people, students, when they're about to enter an exam hall, are pacing outside. Now, that pacing is kind of a walking to burn their stress chemicals because they are stressed of what the question paper is going to be. So, that stress is going to make them perform better. So, this is eustress. Distress is negative, that puts me down, that doesn't allow me to perform. So, like if I'm having a positive stress when I go in for exam, the first question I know a lot, so I spend half the time in one question only, and then I realize I have six more questions, and that gives me distress. How will I finish? So these are the ways. Positive stress makes you perform better. Distress makes you perform worse. Then how do you know? I think one word I will use here, not many of us do. It is called introspection. I have to ask myself every day, am I happy in my situation, my surrounding, my family, my practice? And then if you are honest to yourself, you will come up with an answer that you are not. And many a times, most of us, males or females, disregard the spouse giving us advice. I think that is one error we do, because our spouse knows us the best. So if spouse is telling us, no, you are stressed, we better introspect and find a solution. That's all from my side.
Thank you, sir.
So technically, the positive stress basically motivates you to do things in life.
Yes, yes.
Dr. Maria, please go ahead.
I would also like to ask a question, sir.
Sure, sir. Next.
Sure, sure.
Thank you. Thank you.
Hello, doctor.
Hello.
So Dr. Maria is the chairman for CMAAO, and we welcome her from Philippines. Dr. Maria, over to you.
Thank you very much for your very extensive portrayal of what stress can happen whenever we are under such situations. This is also a topic very close to me because I lecture on the autonomic nervous system and the drugs.
Oh, then that is what causes stress. All the symptoms of stress.
And I would often tease my students and tell them, okay, get one half sheet of paper and then ask them, so what did you feel? Like it was just, of course, a sham thing that I would playfully tease them that way.
Mhm.
So, so thank you very much for your wonderful lecture.
Thank you, ma'am. Thank you. Thank you.
Just on a lighter side, let me tell you two stress over here. One stress is having a Friday night party and getting up in the morning for Saturday morning CMAAO meeting is a stress for me. And for Dr. Monica, it's 12 o'clock
Actual
at night
real
in
stress.
US and she's asleep.
Thank you so much, Rob.
Yeah. So, Dr. Monica, your comments. Friday night.
It was a great presentation. I think all of us who are in healthcare, we understand and we embrace stress, and we've ridden the wave of how stress can carry us through situations, whether it's being in training and staying up all night, or dealing with bringing in a young family when we're young ourselves, and understanding the stresses of our practices as we mature with our practice. I think the only thing that I would add to your phenomenal presentation is the effect of stress and cognition. We underestimate that, if we carry the burden of stress without finding outlets, like how Dr. Bukharia talked about different ways to release stress, is that, our judgment, our cognition as physicians will be impaired. And we need to be cognizant, we need to be self-reflective, as we had discussed, to make sure that we're giving ourselves the break, or recognize that we cannot accomplish what we feel we think we can without it taking its toll on us. And cognition is a very important aspect of our day-to-day professional and personal lives. And we should make sure that we find a healthy balance, and it's a constant battle and a constant self-reflection of finding that balance. That's all I wanted to add.
Thank you. Thank you.
So, Dr. Asrani, I think we also talked about management of stress, and I think it's very important. So, how does meditation and yoga plays an important role in the stress management, and how long people should do it? And is there any message for them?
See, meditation works wonders, but then you have to learn to meditate first.
Absolutely.
So I would say that for meditation, how I teach my patients, you don't need any special environment. You don't need incense sticks. You don't need red light. You don't need flowers. You don't need to sit cross-legged. You sit in a position that you are comfortable. and you focus on your breathing. The idea is to remove negative thoughts from the mind. So if you breathe and count simultaneously, you start focusing on your this thing. Keep a list of 5 items or 5 people who will bring a smile on your face, whatever stress you may be. So I count up and breathe once. Then I think of my grandchild who will bring a smile on my face. I tend to relax. So people can use all of these things, but I think you should be able to meditate even for 5 minutes. That should help you. You need not meditate for 30-40 minutes and all. Yoga, of course, relaxes the mind, relaxes the body. So if your stress is giving you a lot of musculoskeletal problems, yoga and meditation both work well. Otherwise, aerobic exercise burns stress chemicals better.
And what about spirituality?
Spirituality is to everyone's own thing. Like if somebody is not spiritual, you can't force them to be spiritual. But if because of spirituality, despite spirituality, if they're getting stress, then I think they have to look at another level or another way to reduce stress.
Absolutely. So we have Dr. Chong over here. Dr. Chong, would you like to join the meeting? And I'm sorry, I just need to make a correction. I think I said wrong. Dr. Maria is the president for CMAAO, and Dr. Chong is the chair for CMAAO. So sorry, I just made Dr. Asraf.
Yeah, Dr. Ashraf wanted to ask something.
Yes,
Yeah.
Dr. Asraf. I just missed
Thank you very much for giving me this opportunity. I would like to appreciate wonderful talk indeed, and it is a great source of learning early in the morning. Although what
Thank
you
you.
have mentioned that after the Friday and more Saturdays getting up for the CMAAO meeting, I believe it is a very pleasant and the
It's a very
best
pleasant.
time to see the friends. So it is the stress reducing agent. So this is what
It's
I
a
think.
positive stress.
Yeah, it is a positive. My observation, although I'm working as an orthopedic surgeon here in Lahore, Pakistan, and what I used to say, very rightly been mentioned, that the musculoskeletal pains and cardiovascular, that is the ultimate outcome. To my belief, stress is natural and that is not as bad as we think until and unless it turns up into a pathological process. And very rightly been mentioned in the lecture too. What I have experienced and what I used to say to my patients to keep on some social work. Once you are within the community, then I think there is a reduction. And alhamdulillah, some of the people, they have got relaxation after putting some social work in the society because the socio-economic factor that is everywhere, whether it is the United States or it is our continent, India, Pakistan, Bangladesh, and so on, which are striving the people over there, being the socio-economic factor, which increases the stress, and that is one of the factors. Again, thank you very much for wonderful talk. Thank you.
Thank you, sir. Thank you very much.
Thank you, Dr. Ashraf. Dr. Chong, you want to say? Oh, you're driving. You're not allowed to speak. It's too stressful.
I can actually, Sarab, I can. Thank you, Dr. Asrani, for your
Thank you,
talk.
sir.
I'm
Thank
sorry.
you.
I'm sorry I came so late, but stress is something very pertinent to me because I see a lot of my patients with a lot of high stress levels here in Singapore. And I always tell them that 8 risk factors were discovered in 1948 in America in a little town called Framingham. But the number 9th risk factor for heart disease was not discovered. It's called stress. So I find that today's world, stress has become a very, very powerful force in shaping our patients' disease. And basically, anything to reduce stress will be most welcome. Thank you.
Thank you, sir. Thank you.
Absolutely. And I think we are living in an era where the world is going for a big change in the environment. Politically, there's a lot of change happening. Tariff war is happening worldwide. We do not know what's going on. People are losing money on financial side of it. People are losing money on the everything is related. What I believe, your financial stress can cost you your personal stress at home. So I think managing stress is very important, and I think guidance from your end, I think, is something which everybody's looking for. So this is a very important topic we covered. Uh, Anybody else has anything else to say? And before we end the topic,
Saurabh, I'll add one point. You just said
absolutely,
of financial. I think most financial problems occur because of our inherent greed.
absolutely.
You have to control greed, and then you don't get into scams and get cheated out of millions and billions. Yeah.
So just to add here, since I am a financial person, I would like to make a note. I am very closely associated to investments. I'm very closely associated to long-term, retirement planning and everything. So if you're disciplined in terms of your investments, if you're disciplined in terms of your financial planning and your goals, while you are still in an early stage of earning, I think it will really help you to manage your stress and your financial part, even if there are traumas and turnarounds in the world's market. It doesn't matter. If you plan, you should all create your second income as a thing. Your primary income is what you're doing, but secondary income, you should, we have a say in our dictionary says money should earn money. While you're sleeping, you should still be earning, and that's what takes care of your stress, which your primary stuff. So you lose your job, you still have a second income which you have done, but that planning needs to be done when you start working. So if you're not greedy and if you're disciplined in terms of what you're doing in life, I think in terms of investing, I think that's taken care of your financial stress. So I think with this note, we would like to close our meeting for this week. And it was a wonderful topic. I thank you, Dr. Asrani, for this enlightening us for this forum. So do we have any other questions so before we close? Okay. So thank you everyone for joining in this meeting. We will come back soon with a new topic and a new day. Till then, see you everyone. Take care.
Dr. Chong is in an army dress. Is everything okay?
No,
Because
I'm not
laughing
in
is
the army.
also
I'm not in army dress. I'm not in camouflage.
laughing
It looks
reduces the stress.
it looks like camouflage, but it's not.
Dr. Chong, you need to drive carefully, otherwise somebody will be stressed looking at you at your home.
No, I'm at a traffic light already, so it's okay. I'm at traffic light. but great
Thank
to
you.
see everyone.
Hi, very good morning, everyone. Yeah. Today is 27th of July, 2020.